Hello. How are you? Good, I'm glad to hear. So, judging from your chart here, today you are in for a full cranial nerve exam today. Is this correct? Excellent. We can definitely take care of that for you today. Let's see here. Anything else I should know on this chart of yours here? Let's see your name. Yes. Okay. We've also got your birthday. Good. We've got all the information. And last thing, just a bit of your medical history here. Okay, there's nothing specific I need to look out for or anything like that. Okay, perfect. Okay, so now that we've got that all sorted, I'm just going to start out this appointment just with taking a listen to your heartbeat as well as your breathing, okay? And then I've been implementing a new tongue depressor just to kind of check out the inflammation of the throat as well, especially for cranial nerve exams, because you will be smelling and tasting things today. Okay, perfect. So we'll just get started with these here today, okay? Take a listen to that heart and that breathing. Okay. And if you could just take a deep breath in for me. And let it out. Perfect. And then just again on this side here. And just take a deep breath in for me. And let it out. Perfect. Everything's sounding good there. I'm just going to have a listen on the back as well, okay? So just once again, take a deep breath in for me. And let it out. Perfect. And just once more, just on this other side, okay? And just take a deep breath in for me. And just let it out. Perfect. So everything sounds great with your heart as well as your breathing. Do you feel that everything's good with those areas? You do. Everything feels normal. Okay, perfect. Well, if everything looks good with that, we will now go on to everyone's favorite. So with this tongue depressor, I'm just going to have you open your mouth, and I'm just going to gently push down your tongue so I can see at the back of your throat there, okay? Okay, perfect. Okay, and now I'm just going to get you to say, ah. Okay, perfect. Everything looks good in there as well. And doesn't seem to be any irritation or redness. And it looks like all the passageways for tasting and smelling are clear. So we won't have an issue. Okay, perfect. Okay, and we'll just dispose of this here in the garbage. Perfect. And now we'll begin with the regular tests. Which test word would you like to start with? Okay, you want to get the eye tests out of the way first? Okay, absolutely. To start, we will be using a little light pen here. I will try not to shine it directly in your eyes because it can be a tad bright, okay? And I just want you to first focus on the light, follow it around as it moves, and I'm just going to be examining your eyes as you do so, okay? Perfect. Okay. Okay, very good. Very good, very good. Sounds like the construction next door is quite noisy today. Sorry about that. Okay. Okay, just look at it over here real quick. Okay, good, good. Just having a look in the corner of your eye here. And I'm just going to do the same on this side, okay? Focus there. Okay, good, good, very good. Okay, everything looks normal there. Just continue following it. Continue following the light. Okay. And now I'm going to have you look just a little further down here so I can look at the top of your eyes there, okay? Okay, very good, very good. And we're going to do the opposite. Just have a look up here just so I can see under your eyes here. See the lower parts. Okay, okay, everything looks good there as well. Not too much redness, not out of the norm. Okay, very good. Okay, now we're going to get into a little bit more specific with tests. With this one, I'm going to want you to tell me when you see the light come into your peripheral vision, okay? Okay, very good. Just let me know. Very good. Very good. Very good. Very good. 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 Excellent. Okay. Okay. Good. Very good. Okay. Okay. Is that going a little bit too fast for you? Okay, let me go slow it down. My apologies. Very good. Very good. Mm-hmm. Perfect. Perfect. Okay. 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 Good, good. Okay. So, did you find that those were a little bit tough to deal with? I noticed there was a little bit delayed reaction. You do feel there's a little bit? Okay. Is that normal? I mean, normal in your day-to-day, yes. It can be normal within everyone, yes, though. Oh, good. I'm glad that's relieving for you. Yeah, it can be. It's mostly just receptions going to the brain to then going to your mouth to actually saying it, you know? So this can be tricky at times, but as long as you are seeing it come into that perception and there's not too much of a delay, which there wasn't more than not even a second, it was just a slight delay. Oh yes, absolutely nothing to worry about. I am going to make a note of it in your notes though, just so that in further appointments we can make sure that we are taking a look at it just to make sure it's not getting any worse, okay? Okay, very good. So because of, in that case, I'm going to take the test a little bit in a different direction now, okay? I'm going to get you to focus on the top of an item, okay? And I'm going to be moving the light kind of how I was before, just like this. But I don't want you to be distracted by this light, okay? This test will show me what kind of a focus is happening there. Because if there's a focus along with a delay, it could be something that we might want to look into. But I don't see that so far with the other tests. But I think looking at the focus would be quite substantial for this situation, okay? So I just want you to focus just on the top here. And I want you just to stay focused on the top of this instrument here, okay? Don't get distracted by the light here. Okay. Very good. Okay, yes, as I thought, there's not too much concern here. Your eyes don't seem to have problem with focusing on one direct spot. So I think we are in the clear here, okay? No need to worry at all. Okay, now I'm going to move it slightly, okay? Yep, stay focused on just on that one instrument, okay? Just on the top point, the little tiny ball here, okay? Just focus on it. Don't allow the light to distract you from focusing on it, okay? Very good, good, okay. Your eyes are locked on, I see that. Very good. Excellent, okay. So yes, it looks like focus is not a concern, so the delay is merely just normal, okay? Next, we are going to move on to the eye chart, okay? Just to finish off that eye nerve section, okay? Unravel it here. I'm sure this looks familiar. Okay, we're just going to put it right up here. All right. And as I'm sure you've done before, we are going to go through this chart here of all different letters, of all different sizes here, okay? And as I point to each letter, I just want you to say that letter out loud. I also might throw in a number as well as a color I would like you to say, okay? And just based off that question, just respond accordingly, okay? And just starting up at the top here. Very good. And moving down to the second line now. Good. And what about this one right here? Yeah, this one right here. Correct. And can you tell me, what color is this? This color right here. You are correct. That is green. Okay, and we will move down to the third line here. What is this letter right here? T, yes, correct. And what about this one right here? That is correct, yes. And what about this one right here? Yes. And can you tell me what number this is right here? That is correct. And now let's try going backwards, starting on the fourth line here. Yes. What about this one? Correct. And what about this one? Correct. And what about this first but last one? That is correct. Good job. And let's move on to the fifth line here. Good, good. And what about this one? Very good. And this one? Yes, correct. What about this one right here? Yes, and this very last one here. You are correct. And can you tell me this number? What about this number? This number? Excellent. And starting on the sixth line now here. That's right. And what about this one? And this one? And this one? Very good. And what about this one? Good. And the last one? Yes, you are correct. Now, can you tell me the color of this bar down here? You are correct. And what about this one right here? This color right here. Good. And what about this one? Right up here. That is correct. So it looks like we've gotten all the colors. We are going to move on to the seventh line. Can you tell me what this letter is here? They're getting a little more tricky now. Here. Can you tell me what this letter is here? Very good. And this one? Excellent. How about this one here? Good. And this one? Fantastic. And what about this one here? And this one? And this last one? Very good. Now, this last line is a little tricky, so please feel free to take your time, okay? This first one here. Good, okay. What about this one here? Correct, yes. What about this one? Yes, correct. Good job. What about this one here? Exactly, yes. What about this one right here? Very good. And this one? Correct. And what about this one of the last two? Yes, you are correct. And the last one, now I mind you, this very last one is kind of tricky, so please take your time. Yes, you are correct. Your 20/20 vision is perfect. Now, would you like to go and try the other ones at all? No, that's okay. I myself can't get past that 20/20 either, so I don't blame you. Okay, so now we can move on to the next. Which area would you like to go into next for the cranial nerves? want to go into the scent? Absolutely. Let's dive right in. Oh, first, let me just take this back here. Okay, put that chart over here. And then we will get the smells ready. So these need a good shake usually. Okay, yes. Very good, very good. Okay. Now, there are 3 different scent bottles, okay? I'm going to spray this one into the air, and I'd like you just to take a nice scent sniff in, okay? All right, here we go. Now, can you tell me what that scent is? Yes, you are correct, lavender. Perfect. Okay. And let's grab this one next. Now they are all clear, so nothing is given away. And it makes for a nice little visual as well. Good. And here is the next one, okay? Get ready to take a sniff in. Now, can you tell me what that smell is? Strawberry. Yes, you are correct. Yes, you are correct. Good job. Now, let's grab this last one here. This one's a little bit more trickier. We purposely saved this one for the last to see if we can try and stump you. Okay, here we go. And get ready to inhale. And can you tell me what that smell is? No? It is mint, a very subtle mint. That's okay. Most people don't get it. It's very subtle. I myself didn't even get it when we got it. But that's okay, because that one is just more for to see if we can see if you have extra heightened sense. With the other smells, we know that your smell sensories and nerves are doing wonderfully. Yeah, that means we can move on to the next one. Did you have one in mind that you wanted to cover next? Yeah, you want to do the sounds ones next? Absolutely. We'll dive right in. Okay, I have 2 different sounds that we are going to be using today. The first one is a magazine, and I'm just going to be flipping through the pages, and I'd just like you to tell me when I completely stop flipping through them, okay? I'm going to have you listen very closely in case there's just a moment where I'm just reaching for a page, or if you hear slight little finger sounds as well. I want you to really focus and tell me when that sound stops, okay? We're first going to just start on this side, okay? And are you ready? Okay, very good. Let's begin. Very good, very good. You knew immediately. Okay, and then we're going to try again on this side here. Very, very good, very good. Okay, I'm going to try again on this side here. Are you ready? Okay, here we go. Very good, very good. Okay. And last time on this side here now. Yes, very, very good. And then we are going to move on to the next item. Okay, and we're going to be using this brush here, okay? And I'm going to be doing the same thing, but it is a much less intense noise. So I want to see if you can pick up when it starts to decline and then completely stops, okay? All right, we're going to start on this side if you're ready. Okay, very good. Very good, very good. Okay. And just again on this side. Very good. Okay, and we are going to just do it one more time on each side, okay? Are you ready? Okay, perfect. Here we go. Very good. Yes, very good. And last time on this side. Very good. Yes, fantastic. So it seems like your hearing is impeccable, and we don't have to worry about those nerves. So now we are down to the last two. Which would you like to do next? You'd like to do the taste test next? Fantastic. We'll jump right in. Okay. Now, we have 3 different flavors here, okay? 3 little vials. And we just need to make sure we stir up properly here. Okay, very good, very good. It is a little bit of a thicker liquid, so we can't just shake the bottle, unfortunately, but we do have the dropper in here that makes for a good stir, and there we go. That's exactly what we're looking for. Okay, and now I'm just going to gently drop this on your tongue. You will taste it and let me know what the taste is. Okay, perfect. Okay, and just stick out your tongue here. And 1, 2, 3, 4, and 5. And now let me know what that flavor is. That is correct. Gooseberry. I'm surprised you got that so quickly. You're a fan of gooseberry. Fair enough. Okay, let's move on to the next one. Okay, and again, let's give this one a quick little stir here. Okay, very good, very good. Okay, there we go, perfect amount. And now for the next taste, in the taste test, if you'll stick your tongue out. Perfect, and here we go. 1, 2, 3, 4, and 5. And what does that taste like to you? Zucchini. Yes, very subtle, but you were able to get it. Wow, you were on point with your taste buds. Let's do the third and see if you can get the most challenging one yet. Okay, and last time, give it that little stir here. Good, very good. Okay, there we go. This one takes a little bit more of a stir. And stick out your tongue there. Perfect. And 1, 2, 3, 4, 5. And one extra. Can you tell me what that taste is? Espresso beans, yes, you are correct. I'm so shocked you got all three. That means your taste buds are amazing. They can have such a perfect palate that they are able to identify any and all foods. So congratulations on that if you did not already know. And we are just going to jump in to the very last one, okay? Sounds good. Okay, so there's going to be two little tests we're going to do here, okay? We're going to use this brush, and I would like you to tell me which part is gently stroking your face, okay? Is it the brush? Or is it the other end of the brush? Okay? Perfect. And just focus on my nose here. Don't pay attention to the brush. And as you feel it, just say which one it is, okay? Very good. Yes, correct. Correct. Correct, correct. And what about now? you recognize the switch. Good job. Very good. Eat it again. Good job. Good job. Good, very good. You can feel that all over. Okay, good. All over your face there. Good, that's what we are looking for. Perfect. Very good, very good. Perfect. Everything looks great with that. All the sensations in the touch of the face seem to be perfect, okay? Excellent. Now, the last one that we're going to be doing is I'm going to be gently tapping on your face, okay, in different parts. And I just want you to tell me which area I'm tapping, okay? Okay, very good. And here we go. Good, very good. Very good. Yes, just right there. That's right. Good, good, very good. Very good, very good. Perfect. So everything seems to be in working order with that nerve as well as all your other nerves. So I think this checkup was a success, and I think you have nothing to worry about in the cranial nerve exam area. Perfect. Okay. Well, please feel free to make another appointment if anything does come up or you feel something doesn't feel quite particularly right, okay? Okay, very good. Well, I will see you next time. Take care and stay safe. Bye now.